With almost 54,000 doses of the AstraZeneca COVID-19 vaccine in country and still only 15,000 administered, are we seeing the results of vaccine hesitancy? Welcome to On the Record. I'm your host, Jerome Sawyer. Since the initial rollout of the COVID vaccine, various groups have had the opportunity to be vaccinated. And while 15,000 administered doses is quite impressive, many Bahamians still seem to be reluctant about signing up for the COVID-19 jab. Tonight on The Record, we discuss vaccine hesitancy. Stay tuned. Our discussion begins on the other side of this break. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. I'm your host, Jerome Sawyer, and tonight we are discussing vaccine hesitancy. Let's face it, for all the scientific and medical information out there to support the vaccine, there are many still uncertain or outright opposed to it. And lest we forget, we are still fighting a deadly virus. According to Assistant Professor at Duke University, Lavanya Vasudevan, in the absence of high vaccination coverage globally, we risk dragging out the pandemic for several more years. And what's even more alarming, she says, is that every day the virus is in circulation is an opportunity for it to mutate into a more deadly variant. Yet there are millions globally who have eagerly lined up to take it. I am one of them. Having been COVID positive in September, I was eager to protect those around me who have up to now managed to escape it. For many, the arrival and dissemination of the vaccine was a sign of the resumption of life. Take, for instance, this guy, my 82-year-old father, Osborne Sawyer. He's a colon and prostate cancer survivor. His vulnerability due to a compromised immune system made him high risk. For 1 year, we spoke only by phone. Saturday, March 20th, we arrived at Loyola Hall. He was eager to receive his vaccine. Less than a minute later, it was over.
How do you feel?
So far, so good.
Yes, you do. You're going to have to stay over there for 15 minutes with this pass over there. She'll assist you to the seat.
Every vaccination then requires a 15-minute observation period for side effects. While we waited for the observation period to pass, two other well-knowns showed up for their jabs.
Mr. David, quick question. What was the experience like getting the injection?
It was
My experience? It was okay. Nothing. I didn't even feel the prick. That's maybe it's the nurse that administered it, but I didn't feel it.
This is Nurse Ruth Bastian, 47 years as a nurse and in charge of our immunization.
Eventually, I would get an opportunity to get my very own.
She's very much aware of her.
Well, my guest for this segment of the show is a newly appointed PAHO WHO representative in the Bahamas and the Turks and Caicos Island, and the Bahamas' Minister of Health. I'm happy to welcome on the show Dr. Eldonna Boisson and the Honorable Minister Renward Wells. Welcome to On the Record.
Thank you so much.
Thank you so much.
I'm happy to have both of you here, and this is your first appearance for both of you on the show. We're very happy to have you on. We chose this topic tonight because we realize that there are many, not just in the Bahamas, but around the world who are still hesitant. So, Dr. Boisson, I'm going to begin with you. Explain for us the importance of smaller countries like the Bahamas and the rest of the Caribbean getting to 100% vaccination or as close to it as possible.
Okay, that's a good question. Why do we need to have this high level of vaccination? Right now, vaccination is one of the tools that we have in our armory to fight this virus. The public health measures are also very important. It's not dependent on vaccines alone. However, for us to get to a level where vaccines are protective, we need to have at least about 70 to 80% of the population vaccinated to give us herd immunity and to be able to protect the wider population.
Minister, just yesterday we heard from the Deputy Chair of the Vaccine Committee confirming that there will be a pause on vaccinations. What does this mean for us as a country, and what about those who are planning to receive their first dose in the upcoming weeks?
Let me be clear, in regards to the pause, it's only going to be a pause in New Providence on Saturday. Vaccinations in New Providence will resume on Monday. It's going to be giving the committee an opportunity to assess all of the individuals in country who are a part of our IT platform who've already been vaccinated. We're going to assess how many more doses we have in country, when we will receive additional doses so that we can know exactly when to give our second dose to those who have received the first dose. So it's an evaluation process.
I must admit, when I first saw that, it made me a little nervous because I wondered whether we were at the point of running out. Can you give us any kind of reassurance that we are on track to continue these vaccinations until more supplies arrive?
We are on track. As I said, Jerome, we will resume again on Monday in New Providence. It's only going to be a one-day pause of Saturday. As you would know, we are rolling out vaccinations in Abaco today, and we have been vaccinating Bahamians in Grand Bahama and in Eleuthera. So the vaccine program is moving forward. The vaccination program is moving forward.
Dr. Boisson, when can we expect to have the remaining doses of the COVAX facility through the PAHO WHO initiative?
We have been in communication with the manufacturers, and the date that they have given to us is May 2021 to get the balance of these doses. Of course, you know that there's a global demand, and so we're in contact with them on a consistent basis, but so far we're still on schedule for May.
When we say global demand, I always think about sort of where do we sit at that table when we're negotiating. You've got larger nations with millions of people, they have more money, they have more influence. And then, there are countries like the Bahamas and the Caribbean, as we say, with a handful of people. How do we negotiate when we're up against those larger countries?
And this has been the reason for COVAX, exactly what you've described. so that we can have bulk buying whereby all these small countries and some of the larger ones as well, we have some very large countries in South America who have bought into COVAX. And so as a collective, the monies go pooled together, and we can therefore negotiate in bulk to get the best possible price.
One of the concerns raised has been, why did we end up with AstraZeneca when you've got Pfizer, you've got Moderna, you've got Johnson & Johnson, another conversation, but you've got all these other vaccines. How did we end up receiving the AstraZeneca?
The process for that really, first of all, countries had to be ready to receive vaccines in terms of all their logistics and their planning and so forth. The Pfizer vaccine was approved first before AstraZeneca. And at that time, we had to determine which countries were ready and which countries wanted to receive Pfizer. For almost all of the Caribbean, Pfizer is a huge challenge because of the ultra low temperatures at which they have to be stored. And even the purchase of those freezers for those types of temperatures were a challenge. And so Pfizer was a difficulty for all the Caribbean countries to accept. The next vaccine that was approved was AstraZeneca. And by that time, all the Caribbean countries, including the Bahamas, had everything lined up, all their plans done and so forth. They had the freezers that could accommodate these vaccines. And so this is why AstraZeneca, was what the country went with.
I want to talk about Johnson & Johnson, but I will come back to that. We know that the Bahamas is very different from many other countries just because of our topography, how we are made up. What special challenges do we present? Minister, maybe you can take this, or both of you, either one. But what special challenges did we present in getting this vaccine?
Well, I would say, getting AstraZeneca was not the challenge, as the PAHO representative would have said, Dr. Boisson. Our issues would have been the logistics of dealing with a vaccine such as Pfizer in moving it throughout our archipelago, as you would know, Jerome. We have about 57 population centers in the country where we have medical facilities, and we would have needed to move the vaccine around in country in that ultra low temperature environment. And so for us, it would have been a logistic challenge, even though we'd already planned for it. But we were a little bit delayed in getting the ultra cold temperature freezers, which in a week or two will be in the Bahamas. So we will be able to have Pfizer as an option in the next week or two.
And any idea very quickly on when we expect the Pfizer to arrive? Will that be coming in May or?
We are in negotiations now with the manufacturer, and the Prime Minister will make an announcement once we are sure as to date and time. But we have made provisions for Pfizer and the logistics of moving Pfizer into our family islands.
Dr. Boisson, just this week, Johnson & Johnson halted their vaccinations because of 6 cases out of 6.8 million who developed severe blood clots. Are there any plans to bring Johnson & Johnson to this part of the world in terms of the region? And given the pause in the vaccination, are you concerned that that may lead to even more vaccine hesitancy?
It is a concern that it would lead to vaccine hesitancy, but it's certainly not a concern that we have detected these cases. In fact, it's heartening to me because it tells me that the surveillance systems are working and they are detecting any event that happens to somebody post-vaccination, whether it's related to the vaccine or not. And right now, there are investigations being done to determine if indeed the outcome is related to the vaccine, if it's a cause, or if it's simply a temporal relationship. We still don't know that yet. Right now, Johnson & Johnson has pledged 500 million doses to COVAX, and we are still pursuing that because in the evidence that we have so far, we see that benefit still outweighs the risk. When these investigations are done, we may find that indeed there is no cause. So we're still pursuing that line.
There are a lot of myths and even conspiracies out there associated with being vaccinated. What do you say to folks who are still sitting there hesitant, afraid, whatever they may be feeling or going through, who are hesitating, what message do you send to them?
One thing I'd say to begin with is get your information from reliable sources, from World Health Organization, Pan American Health Organization, and your very own Ministry of Health. There's a lot of information out there about the vaccines, and not all of them are accurate. Much of them are not. They seem very convincing. So that's my first advice. Get your information from reliable sources. The second thing to think about is what might happen to you if you get COVID, the virus. We have seen that it has no respect for age, gender, physical health, or any such thing. We have very young, healthy people in ICU. We're seeing more and more of that every day. We have young, healthy people dying of COVID. So you want to consider that while there is maybe a chance that there is a link between the vaccine and having blood clots, a very rare occurrence of that taking place, there is a very strong link between having COVID virus and having blood clots, amongst many, many other severe conditions. So at this point in time, the benefit definitely outweighs the risk.
Dr. Boisson, I say to people all the time, don't listen to or don't subscribe to the University of WhatsApp or the Facebook Institute of Technology and Science. Minister, do you believe that soon there will be vaccination requirements for travel, whether that be for entry into the Bahamas or internationally? Do you foresee that anytime soon?
Well, there's there's requirements now for travel in regards to testing. I don't know whether or not the globe is going to go in the direction that all countries would be expected to ensure that travelers have like a vaccine passport. But there are those who are speaking about seeing how we can institute such. As you would know, in the international health regulations, you can't move across certain countries' borders in regards to, you take, for instance, just yellow fever. That is one of those pathogens that is in the international health regulations, I do believe. I don't know whether COVID is going to end up being that kind of circumstance for the globe, but if it is, the Bahamas is in a position to be able to provide that kind of vaccine passport.
If I can very quickly, do you foresee though, or is the government even discussing at this point the possibility of making a vaccine passport mandatory?
Well, for everyone who's been vaccinated, they will be able to have it. There are countries that are, obviously, we're going to be looking at ways to make international travel easier for persons. And I believe the vaccination, being vaccinated is going to be, would certainly make that much easier because you don't need to go and take a test and then fill out all of the documentations for such.
But nothing mandatory at this point.
There's nothing mandatory on behalf of the government of the Bahamas at this time, other than the testing requirements and our visa requirements for coming into the country at this time.
We're just about out of time, so I'm going to just throw this question to both of you. Are you concerned that hesitancy is going to cost us in the long run? Dr. Boisson, I'm going to begin with you.
That's definitely a concern. We have to keep on trying to debunk myths, coming on shows like this and doing everything we can. In addition to vaccines, we also need to make sure we keep singing the song about the protocols, the public health measures to protect yourself. Your hand washing, masking, distancing, not touching your face, sanitizing surfaces, because those are as important as the vaccine.
Those things are still in place, and that's important that we continue to push that message. Minister, are you concerned that this vaccine hesitancy is going to cost us, whether it be health-wise and even economically in the long run?
There is the possibility. I think Dr. Boisson would have adequately explained our circumstance. But I will tell you this, Jerome. We've seen an awful lot of Bahamians who have stepped forward now to be able to take the vaccine. We have lines of individuals at the vaccination site. We are a little bit concerned of the hesitancy among healthcare workers, but we're working on that in country now.
And that's very good news. Minister, Dr. Boisson, thank you so very much for coming on. I wish we had more time, but we've got a lot to talk about within this hour. But I do appreciate you coming on, and I'm going to extend that invitation for you to come back. It's been a long time, Minister, but I've been asking for a long time to come on the show. I'm glad you finally made it. I wasn't going to let you get off like that. But I'm happy you made it. Thank you very much. We'll be back at you. Dr. Boisson, I'm going to come back at you again, spend a lot more time in the future talking, because this is going to be with us for a while. Folks, thank you very much. To our audience, don't go anywhere. When we come back, we turn our attention to a lady who is regarded as the nation's hero during the peak of the pandemic. You don't want to miss it. Stay with us. You're watching On the Record. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. I'm your host, Jerome Sawyer, and tonight we are discussing vaccine hesitancy with the experts. A fear of the vaccine's side effects, both known and unknown, has been one of the major factors in vaccine hesitancy here. Many Bahamians have been taking to social media using hashtag #GetVaccinated to speak about their experience with the vaccine, and not all have been delightful. In this segment, though, we do a deep dive into the side effects of the vaccine and try to dispel some of the rumors associated with this vaccine. My guest for this segment is the nation's chief on infectious diseases, the director of the National HIV/AIDS and Infectious Disease Program at the Ministry of Health, Dr. Nikkiah Forbes. No stranger to On the Record. Welcome back.
Thank you, Mr. Sawyer. Always a pleasure to be with you. Good evening, Bahamas.
So there are a lot of outlandish theories out there, and I'm hoping that we can disprove quite a number of them. Many people believe that this vaccine, or are saying that this vaccine can alter their DNA. Let's start with that.
Thank you. So that is a myth that is going around, but the vaccine does not alter DNA. So there are several vaccines against SARS-CoV-2, the virus that causes COVID-19. So the mRNA vaccines, they basically teach the body's immune system to mount an immune response, and they do not enter into the cell nucleus at all. They do not interact with DNA. And as it relates to the AstraZeneca and the Johnson & Johnson vaccine, for example, they use a virus, a modified virus, to introduce the COVID-19 spike protein. That's what causes people to get sick. That's really what people react to and causes people to get sick, to mount an immune response and essentially teach your immune system to be armed so that if you come in contact with COVID-19, you will have good white blood cells to fight and neutralize that infection. They do not alter DNA. They just interact with the cell transiently. So that is indeed a myth.
So let's jump straight to those side effects. What are some of the side effects that are likely to occur anywhere from, let's say, 3 to 72 hours after taking this vaccine?
So most of those side effects are mild side effects, and they can be side effects that people will have if they have the flu vaccine, for example. So that could be a sore arm. It could be fever, chills, headache, feeling tired, loss of appetite, muscle aches, for example. And those were the main side effects that were reported when the vaccine was in clinical trials. And similarly, in the real world experience, that's what we're also finding. Now, there is an extremely rare side effect that has been described, and that can be some blood clots in some of these vaccines. For example, the AstraZeneca vaccine, There was an extremely rare side effect of blood clots in some persons that got it, but the chance of that is very low. It's 0.006%. And in the Johnson & Johnson vaccine, we're hearing that there have also been some reports of blood clots, and there were 6 persons reported to have blood clots out of 7 million doses of that vaccine that were administered. And both of those vaccines, the side effect was reported.
Now, are there any groups that are predisposed to blood clots? Like I've heard people say to me, oh, well, I won't take it because I have this condition or I have that condition. I may be at risk of a blood clot. Are there any groups, are there any kinds of comorbidities or anything that people may have in a particular grouping that may make them predisposed to a blood clot?
Yes, so blood clots, they're not uncommon conditions, Mr. Sawyer. I would say that they're fairly common, and there are factors that can make someone more at risk for blood clots. And we consider those if someone is immobilized, for example, if they have gone on a long car or plane ride, if they end up bedridden, if they have a fracture, for example, they could be at risk for blood clots. Then we also think about factors that could make platelets more likely to stick together. And that could be a side effect of other medications, for example, hormonal contraceptive pills for women. There could be inherited states that make people more likely to have a blood clots. And there could be a family history of blood clots in those situations. And then we also think about damage to the blood vessels, for example, after a procedure, or after we introduce a catheter medically into the blood vessel, that could predispose persons to blood clots. Like I say, they're not uncommon in medical science, and it's very, very important that we look at the context of this, because COVID-19, actually getting COVID-19 increases the chance of getting blood clots. And there are many other therapeutics that we use, like the oral contraceptive pill, that 3 to 9 women out of every 10,000 women who are on the oral contraceptive pill will develop a blood clot from being on the oral contraceptive pill. So you always have to look at vaccines and medicines and therapeutics as a risk versus a benefit. What's the benefit that you're getting? What are the risks of having adverse reactions? So the majority of people on medications, and indeed who get the vaccine, will not have an adverse reaction, and you have to balance it. So at this time, the benefit far outweighs the risk of possibly getting this very, very rare side effect. We do know some additional things. So of those people who were described as getting those blood clots in the vaccinated groups, they were younger persons under the age of 50. They were more likely to be women. And we also have to be aware of the signs and symptoms so that we can be well informed. But like I said, it's a benefit versus a risk. You have to consider the risk of getting COVID and an ongoing outbreak, and the risk that you could get a very rare side effect.
Very quickly before we move forward, if you are, if you feel you may be at risk, etc., is it a good idea for you to consult your physician?
Yes, it's always a good idea to consult your physician and weigh the benefit versus the risk. It's definitely a good thing to do.
Let's get into some, hardcore facts at this point. Does the vaccine prevent you from getting COVID-19, or does it minimize the effects?
It does both. Are you hearing me?
Mm-hmm.
It does both. So it reduces the chance tremendously of getting COVID-19. In all iterations, whether you're asymptomatic, mild, moderate, severe, or unfortunately critically ill. And the effectiveness was reported, or the efficacy was reported for these vaccines. And it's generally very good. It could be anywhere between 95% for some vaccines or 85% for some other vaccines. But what all of these vaccines do across the board is they protect against getting severe disease, being critically ill, and needing to end up in hospital or dying from COVID-19. And that's very, very important. You still have a chance of getting COVID, and that could happen for a lot of reasons. But the point is, then your symptoms should be mild, or you should be asymptomatic and not have to be in hospital, which makes it a little more bearable if what you have is essentially flu symptoms.
So essentially, you, with this vaccine, you could get it and not even know you have COVID, eh?
You could always get COVID and not know you have COVID, because some 40% of people with COVID-19 may be asymptomatic, but they can spread that to other people who will not be as lucky. We still don't really know why some people end up severely short of breath, needing oxygen in the hospital, or dying.
Interesting. So still learning. Now, let's take the flip side of this discussion. What are the risks for those who do not take the vaccine? And I want to put that into two categories. There are those who say, well, you know, I've had COVID. I fall into that category, but I still took the vaccine. People say, well, you know, hey, I've already had it. I've built up these antibodies. And then there are people who say, well, you know, I've avoided it all this time. We're on a downward trend. I should be okay. I'm not going to take it. And then I guess we can add on the third, you know what? I don't know enough, so I'm not taking it. What are the risks to those who do not take the vaccine?
Very great question. Let's talk about it one at a time. So if you have had COVID, you could get COVID again. So there is some immunity, but how long that lasts varies from person to person. It could be as short as 3 months for some people. It could be longer for other people. And we're studying why that is. And in some cases, people who get COVID the next time, they can get sicker with some of these newer variants and have to be in hospital. So the point is, if you have had COVID, you should still consider getting the vaccine. Anywhere after 1 month after you've had COVID, you can consider getting that vaccine, but you will have some immunity from the infection. Now, the second point, I've had COVID and cases are going down. I'll just continue to take my chances. Well, you can get COVID while going about your daily activities. We want the public health measures to be utilized by everyone because we know that they're very, very effective. But there are persons who will be exposed to COVID-19 as they go about their daily activities. Masks are somewhat protective, but they're not fully protective. They can still allow some particles to be filtered through and you can breathe them in. So it's not a bulletproof strategy to say that I'm just going to just follow the public health recommendations. You want to use these things in combination, these prevention steps, and vaccines are a good prevention step. Further, you don't know when the outbreak can change. For example, we're seeing that cases are rising now. And so if you can protect yourself, you should really think about the benefit of that and how that could be very good to prevent the problem of maybe needing to go to the hospital or having shortness of breath. I like to try and explain things in everyday language. And so if you get COVID and you end up in the hospital with shortness of breath and can't breathe or have to go on a ventilator, you might look back and say, wow, I wish I'd gotten that vaccine and taken my chances of getting a sore arm or a headache. That may not have even happened to me because it would have prevented me from getting to this point. And to your last point, well, you know, cases are going down. You will take your chances. Like I said, the outbreak can change. And so you have to realize that the vaccines are a good preventative modality. And they're essentially a way that we can fight COVID-19 and really make impactful change in this global outbreak and in country.
Final question, Dr. Forbes. Are you worried that the increases in cases that we've seen, a steady increase, are you concerned that this is an indication that we are headed into a third wave?
So we are in a third wave of COVID now. So when we first saw the increase in cases, we tried to establish if that was a spike or a cluster or work case exposure. But we saw that cases were gradually going up over a certain period of time. And so when that happens, when you have a sustained increase in the number of cases over time, that's called a wave. And cases are continuing to go up. And what do we do about that? We have to try and stimulate that. We have to try and get that under control. And the way to do that is prevention, public health measures, a robust vaccination plan, and control efforts to identify persons with COVID, put them in isolation, do contact tracing and quarantine. And we all have to follow the public health measures if we want this to work.
Dr. Nikkiah Forbes, I think if there is one thing that we want people to take away from this segment is your comment, we are in a third wave. And that should be a very sobering message tonight. No doubt about it, we are certainly in that third wave. Thank you very much as always. Great information, nice talking to you. And we always appreciate you sharing such great information.
You're most welcome. It's always a pleasure to be with you.
And when we return, we switch gears to speak with a volunteer down at one of the vaccination sites. Stay with us. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. Thank you so much for watching. I'm your host, Jerome Sawyer, and tonight we're talking vaccine hesitancy. While vaccine hesitancy may exist because of uncertainty, lack of credible information, misinformation, and fear of the long-term effects, the reality is that it is still a highly infectious, deadly virus. By far, though, the vaccination process has been the most exemplary form of what a private-public partnership should be, and how the use of technology and government agencies can truly make our experiences better. My guest for this segment of the show is a volunteer at one of the local vaccination sites and has been giving of her time selflessly to contribute to her nation's success against the war on COVID. She's no stranger to On the Record or the airwaves. Jessica Robertson, welcome to On the Record.
Hi, how are you? Thank you.
I'm good. You're usually sitting in this seat when we're doing this show. So good to have you on that side. Now, what's it like for you being a volunteer, but also a journalist? Because you're looking at this, I'm sure, from both aspects, eh?
You know us. We don't turn off that journalist hat at any point, no matter what. This has been such a rewarding experience. I kind of got called. Someone told me that they needed volunteers. This was maybe the second day that they'd started. So I said, I work for Blue Lagoon Island. We're unfortunately not open full time because we don't have the tourism population coming in now. So I have time. And I thought, let's not joke here. If I give of my time now, we might get ourselves, the country, to a point where I can go back to work full time sooner as well. So it's not completely selfless. So I went down and very easy, helping at nursing stations with data entry. And after a few days, I used to work for Barry Rassin, who's been kind of heading up the volunteer effort. And so within a few days, I was asked if I would be one of the facility managers. I've been down at Loyola Hall almost every day since the process started. And it's such a rewarding experience, especially in those early days when we were able to help a lot of elderly people who were just flustered because as good as the technology was, they were struggling with it. So they'd show up and they're just so grateful to have somebody say, hey, we'll take care of you. We got you. And it really has been at Loyola Hall, which is on Gladstone Road. We've been doing, up until today, we've been doing about 520 appointments a day. So it's a lot. It's 52 appointments coming through every half hour. And it is.
Take us through now the process of signing up and what it's like. I mean, you talked about the elderly and, in the early days, but take us through the process for those who don't know what to do.
Sure. You go to, there is a website, and they've done an amazing job. We have a new system that was launched right after Easter, and it is vax.gov.bs. You go in there, you put in your phone number, you put in your details, you pick your appointment. It's as simple as that. You immediately get an email confirming your appointment, tells you what time you're coming, and you show up with that code. We can, if you forget the code, the volunteers can pull you up in the system if you have an appointment at that center for that day by your name, by your NIB number. And so you just come through. So it really is a simple process. But that said, there are still some people who struggle with it. And East Street, the Church of God of Prophecy, has been a fantastic center. And they are a primarily walk-up center, acknowledging that there is this challenge. People don't necessarily have access or know-how. And so people can just walk up there and they will make appointments for them on the spot and get them through. Whereas Loyola Hall, Bahamas, Atlantis, when that one was open, I think we've shut that one down now. Those are, and Kendall Isaac's Gym, you have to have an appointment to get in there. But there have been appointments available. I know someone this morning who made an appointment for one of the centers for tomorrow as well. So it's really has been easy. And what was nice as a volunteer was the technology team really listened to the challenges we and the public were having with the first system. And when they launched this second system, I was like, wow, you guys really took to heart what we were saying and have made it. And that's what really has made this whole process. It is, as you said, a public-private partnership initiative. And it wouldn't work any other way, I don't believe.
That brings me to my next question. All of the comments that I have heard and I have seen written on social media have been very complimentary. This appears to be a great example of what a public-private partnership can be, and people are excited and impressed about how smoothly the operation is running. What do you attribute that to?
Well,
the reason I said, because whenever people say government, they go, oh, Jesus, here we go. But this is, what's led to the success of this?
Well, there is, at the committee level, clearly they put the right people on that committee at that level to come up with the system, to figure out how to make this work. I mean, when I tell you this is a logistical challenge of unbelievable proportions. You think about the number of vaccines, you got a 2-dose vaccine that you've got to get into the arms of how many people across how many different islands? It is logistical. But so they came up with a system and they put it in place. And I came in, I'd say day 2 or 3, I started working it. But what I can tell you is at the end of every day, someone would come around and say, what worked? What didn't work? How can we fix this? And we've been tweaking the process every single day up until this week, even with the new system, as we're looking at it going, wait a second, now could we do this? And then we test it. And it's everyone being open to making this the best experience. We've had an army of volunteers out there, and there are some people who come out every single day. There are some people who give a couple hours a week, depending on what their schedules allow. We've got now companies that are allowing their staff to come and volunteer as well. They're giving them time to come. Because you think about this, we're going to be doing this for months and months, right? Because it's 10 to 12 weeks between first dose and second dose. So even if we're just dealing with the people who've been done so far, that's still months that this is going on. When we get the next batch of doses in, we'll be ramping it up again. We have volunteers who are going down with the clinical teams to family islands. You have an army of volunteers being set up on each island to make this work. So basically what we're doing is taking the system that we've figured it out, it works, and just kind of dropping it into every new location. Last week, I was at Kendall Isaac's. I was asked to go down as one of the facility managers to get that up and running on day 1. And I had never been in that facility, well, not in this capacity. I'd not been there. We got there, and it literally was a replica of what we had at Loyola Hall. So we were
I've got to ask you, I know that you all have been asking for volunteers. You've been putting it out there. If somebody wants to volunteer, how can they become a part of the volunteer system?
What I would suggest is they email covax@bahamas.gov.bs, and then just give your name, give your email address. That will then go into a database and you will start getting emails. And what's nice is the way it's all set up, is, as a volunteer, you can just go into the system once you're in that database, and get those emails. You just go in and you see where there's a need, and you sign up for what works with your schedule. Like I said, some people, we now have Kendall Isaacs, which is from 2 p.m. to 6 p.m. And so that one is to accommodate teachers and other people who can't get away during the day for the vaccine.
Yeah.
So if you're stuck at work, you can come later.
Not everyone is signing up. Not everyone is showing up. That's the point of the show. There is still some hesitancy. Yeah. When people say to you they are afraid, or they present these theories as to why they should not take the vaccine or will not take it, what do you say to them? How do you have that conversation when people say, but I don't know, or you know what, I'm just not going to do it? What do you say?
For me personally, it depends on what their hesitancy is based on. If it's just I heard or they say and they can't really justify their hesitancy, at this moment, I don't really have the time or the energy to try and convince somebody to be open-minded. If people are open-minded, then I just point them to other information. I say, look, we've had how many thousand Bahamians have gone through. I've not heard of any major significant side effects being reported here. And we know how things work here. If one person developed a major side effect, we would all know in minutes. And I just ask people to be open-minded to it, because the reality, and I also would say to people, what's the alternative?
Exactly.
Show what we're going to get out of the situation.
That's certainly the point of this discussion today.
Yeah, I personally had the vaccine coming up on 4 weeks ago. The next day I was exhausted. I attribute it to the vaccine and a couple of other things that were going on at that time for me. And so that day it was a Sunday, thankfully for me, and I just pretty much hung out on the couch and watched Netflix all day.
Gotcha. Jeff, I want to thank you. We've got to run. We're out of time, but I thank you. Thank you for your service. Thank you for sharing this with us and giving people some insight. I appreciate it. As I say to people, do not tune in to the University of WhatsApp or the Facebook Institute of Science and Medicine. Get the facts. Jess, thank you very much. Keep up the great work. We appreciate you. And listen, when you're free, you got to give me a break again, eh? Take care. We have one last segment coming up for you, and we will turn our attention to Eleuthera. Don't go anywhere. We'll be right back. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. And welcome back to On the Record. I'm your host, Jerome Sawyer, and this is our final segment in the show. Tonight, it's been all about vaccine hesitancy. And in this final segment, we take a closer look at vaccinations from a Family Island perspective. My guest for this segment of the show is the Member of Parliament for North Eleuthera, Mr. Howard Rickey Mackey. Mr. Mackey, welcome to On the Record.
Thank you, Jerome, for having me.
What has the fight against COVID been like for you all from a Family Island perspective?
Well, I think we've been trying our best to adhere to protocols, but some of the difficulties we have is the high cost in the test, the COVID test, the PCR, as well as the rapid antigen. We want to adhere. We have been doing quite well. Our constituency is probably the only constituency that's been almost fully open during the pandemic for quite a period of time. However, the challenge we're facing is these high costs in tests that we're experiencing.
Give us an example. When you say high cost of the test, give us an example of how expensive they are and who's administering them.
Okay, right now most of the tests are administered for travel purposes privately by private practitioners. In terms of cost, you can get a rapid antigen test in Nassau from anywhere from $16 to $22. You can get the PCR test for about $120 to $125. Here, depending on how rapidly you want the results for that test, it can run you as much as $302. Wow. And that's extremely expensive for persons that have not been working for almost a year. We understand what the pandemic has done to us as a country and us, particularly in the North Eleuthera area as a community. However, we feel that these prices are too exorbitant. There needs to be a coming together of the government and the private sector to make this more cost efficient for these individuals.
Have you made representation to the government, to your colleagues, to try and do something to assist?
I've had conversations, or I've put it out there that these costs are too expensive and they have to be dealt with. They know my position on it. I've gotten assistance in certain instances where we are reaching out to deal with the problem that we have experiencing, but I don't think enough is being done. Just this week on Monday, I had to reach out to assist someone who who's traveling to Nassau, who's a cancer patient, but has to travel to Nassau for treatment, and she couldn't afford it. There's no reflection on her or whether or not if she was a responsible individual and saved her money and didn't squander. It's just that she's in a financial place where she needs help and assistance.
Understood. And many people are in that place. Sir, I want
many persons.
Hopefully, by watching this and you continuing to speak out, we can come to some agreement somewhere. Hopefully, there's a facility that can assist in reducing these costs, because that's exorbitant. If I had to pay $300 to get a PCR test, I would find that very difficult as well. Sir, I want to talk though about the vaccine and what has been the reaction to Eleuthera residents to the vaccine coming to the island in the process?
Well, I think we've embraced it. There are some that have their level of skepticism. Facebook has been a tremendous help to many, and then it's been a setback to others. There's a lot of different stories out there that is hindering the public in terms of accepting vaccines. However, for North Eleuthera, I can tell you that when we first rolled out a couple of weeks ago, we were oversubscribed. And in fact, what had to happen was additional vaccines had to be sent here to North Eleuthera to pick up the slack. So I'm satisfied at the level of participation by persons on the ground that wants the vaccine and have been accessing it.
Eleuthera, including the north where you are, Harbour Island, Spanish Wells to a degree, these are major tourism centers in the country, and I know people have been coming and going on the island from the moment that they could. What are the dangers you think we face, as you see it, if people are not readily taking the vaccine and cases continue to rise, or we have this expansion of the third wave that we're already in?
Well, just as you said, it could cause a possible third wave. Persons have been embracing the opportunity to take the vaccines. We are faced with the possibility of that happening as a result of the many tourists that have been coming to our shores. We literally have thousands of persons who are that are returning back to Harbour Island. Spanish Wells is fastly becoming a tourist destination for many, and the mainland, even on the mainland, I'm sure you've seen scenes where we, in my opinion, we are having almost as much flights as Nassau or even more. There are times when persons have to wait on the tarmac in order to come off the plane and to get into the airport terminal because of the level of tourists we have. Now, having said that, the uptick that we did have recently was a result of persons that when they come in, they have to take the test, the antigen test, on the 5th day, and as you know, that there's an incubation period for COVID patients, that 5 to 7 day period, and that's where we've had the uptick. And as a result of that, we were able to manage and handle our situation and move forward.
Do you feel that as time goes on, I mean, we have a situation just today where a restaurant owner has said, if you don't get the vaccine by a particular date, you're going to lose your job. Some private institutions may move towards that. On that island, in particularly where you have people that have small facilities, do you feel that people are going to make it mandatory for workers to have the vaccine?
I don't see that happening here, Jerome.
Why not?
Like I said, there are some concerns in areas. I know my constituency is very diverse. And some portions of my constituency, persons are very apprehensive, and I get that. And I think as time goes on and people see that there's really no danger to taking this vaccine, they will all come on board. But pretty much by and large, persons are acceptive of it, and they're taking it. And I really don't think it should be mandatory. I think it's but you have to bear in mind, there are going to be countries that's going to make it mandatory to enter those countries if you that you have to have the vaccine in order to enter those countries. I hope that don't get to us. And like I said, the persons that are participating in it are ready and willing. We want to get this behind us. It's important that we reach to what the medical profession is saying, to that area where we have herd immunity, and so we can go back to our former life. It's important that we stay safe, but it's important that we embrace every tool that will make it better for us as individuals.
Mr. Howard Rickey Mackey, I want to thank you for taking this time to speak with us today. I wish we had more time, but we had so much to talk about today, but it was important that we get your perspective. I too am supporting your call to lower those costs for the tests on the island. That's exorbitant. People cannot travel and move around with such high costs of testing. So hopefully somebody's watching and there'll be a coming together and some resolution where we look at bringing the cost down. And I'm sure what's happening in Eleuthera is probably happening in some other places as well. Just glad that we were able to get you to speak to it, and hopefully the right people are listening, sir. And those private firms will see the wisdom in reducing the cost. I mean, we're in a crisis across the board. So thank you very much for coming on.
And Jerome, I thank you for having me. And if I could just say one more time.
Sure.
You know, as a young man growing up, they said, be a doctor, be a lawyer, be an accountant, because they make plenty of money. This is a time when we should cut those profits. I know a lot of these physicians, they do a lot of charitable stuff. But in a crisis such as this, I'm of the view, and that is why I've partnered with some of the medical groups where the persons pay so much and I'll pay the difference. But I believe they can offer a better price so that these persons that need to travel, and I'm talking about a lot, the persons who I'm talking about have to travel for medical purposes.
Agreed.
You know,
yeah.
We have to do it better. We have to be our brother's keeper.
Mr.
Thank you,
Mackey,
Jerome.
thank you too. That's a good way to end the show. Hopefully the message gets out there. Thank you very much, sir. Continue to stay safe on the island, and I hope things continue to get better for you and the folks in North Eleuthera. Well, that's going to do it for this show. Just before we go, we want to thank all of the volunteers and the people who've been working, particularly at the vaccination centers, not just the Rotary Group, but Volunteer Bahamas, companies, service groups are all coming together to make this happen. We thank you. We appreciate your work, and we encourage those of you who want to be a part of that volunteer movement. COVAX at bahamas.gov.bs is the email address. You can send in your name and your telephone number, and they will sign you up to become a volunteer. Well, very special thanks to all of my guests tonight. Thank you so much for being a part of the show. That's going to do it for this edition of On the Record. As always, to you our audience, we couldn't do it without you. Thanks also to my technical and production staff. We'll see you next week, same time, same place, right here on The Record.